Anybody there? Hello, hello, that's Hannah. So Hannah, it says all live, it's working, it's in the right place. Technology is just not our friends, is it? But we're here, we're live. I can see that people are joining, so good morning to you all. My name is Lauren. I am the team lead for the Sedgemoor agents. How are we all? There are people joining. It's lovely to see you all. You could be sat out in the garden because isn't it absolutely beautiful? Good morning, Kizzy, and good morning, Brigitte. Thank you for joining me this morning. Thank you for letting me know, Brigitte. That's fantastic. Good to know that you can hear me. I've got every window open in the room today because it's hot, and I'm hoping that means that the cat won't catch a bird out the window because she's pretty good at doing that. Barbara Ruff, good morning, Barbara. It's lovely to have you with us. Thank you for joining. Barbara is someone that we work with quite closely at our Talking Cafe events. She works for St Margaret's Hospice. And the reason that I have asked Barbara to join us this morning is that I am going to be talking about quite a difficult subject, but one that I really hope will help anybody that needs, to engage in this kind of discussion. So I'm going to be talking a little bit about cancer and how people who might be living with, have loved ones who have cancer at the moment or has had presently, how we can help support you. So before I do that, I recognise that it's a really heavy topic, so I just want to ask, how is everybody today? There's 7 of you watching so far. How are you? Are you okay? What sort of week are you having? Hopefully a good one. I think the sun is either really helping people because it lifts your mood, or it's making things difficult because it's hot and it's a little bit more effort to go about daily life when it's warm. Lots of people saying they're not sleeping very well because all of a sudden it's really muggy at night time. So if you are watching and you're not having such a great week, let us know. Tell us what's happening for you and we will do our best to help. So as I said, before I get started, I recognise that this is a really, really tricky subject. So if at any point anything that we discuss upsets you or causes any distress for you in any way, please let us know. Please reach out and ask for help. We are here to support you. So please don't go away from this feeling miserable. Please let us know if we can support you in any way. So we have a really fantastic special agent within CCS, and that is Christelle, our amazing Macmillan agent. She supports people through their cancer journeys, whatever stage of it they're at, with some of the practical things. So hopefully at some point during this chat Christelle will join us, and Christelle will be in the comment section, so that if there's anything you want to ask Christelle, you can pop a comment in the comment section. We would ask, as every week, that you do not post any personal information in those comments because they are public. They are available to speak, for everybody to see. But by all means, if you've got a question that I can generally answer, pop them in the comments. And if there's anything more personal that you want to ask, then please do send us a message on the Talking Cafe page and one of our agents will get back to you. So I'm going to get started. I'm not sure if Christelle has joined us yet, but hopefully she will at some point. So I reached out to Christelle and I asked her to let me know how she's been experiencing things during lockdown, how her clients, how have things been. So I'm just going to read a little bit that she has kindly sent to me. So she has said, cancer is really scary on a normal day, but having to live with it during coronavirus has added massive amount of strain to those living with it. So she has said that for a lot of her clients that appointments were cancelled, treatment was postponed, so many people were stuck in a situation of not knowing what was going to happen. A lot of her clients, of course, are shielding to keep themselves or loved ones safe, so that's really difficult. A lot of her clients had real concern about the status of their cancer whilst they were shielding and not having treatment. Was it growing? Was it coming back? Really, really difficult times for people. And then of course we have a lot of clients who sadly in their last stages of their cancer journey and are terminal or palliative, receiving palliative care, who are feeling really torn between wanting to live their last days enjoyably and do what it is that they thought they would be able to, feeling completely cheated at not being able to go away or see family, and that's really difficult. And then Christelle, of course, has sadly had some clients and some loved ones who have lost somebody close to them, and they were not able to deal with that grief in the normal way. They weren't able to have the funerals in the same way, all that sort of stuff. It's really, really difficult. So what Christelle wanted to say to you, anybody that has been through this during coronavirus or will go through it soon, is to know that Christelle is out there for support if you need it. So all of those practical things that might need help with, so financial issues, counselling, bereavement support, transport to appointments, how to get food and prescriptions if you are someone who is shielding because you are having treatment, please reach out to us. We can put you in contact with Christelle and she can help you with some of those more practical things that you might be struggling with. Christelle has kindly said that cancer is a big enough worry, let alone all the other things that are coming with it at the moment. So please let someone else help with those things. Christelle is available to support, so please do reach out. So Christelle, as I said, she works for Macmillan in partnership with CCS, so she's a Macmillan agent, very special. So if you or a loved one or someone that you know might benefit from support, then please do get in touch with us. We can put you into contact with Christelle and she can do her absolute best to try and help you through this really difficult time. So Macmillan also support, I was having a look at our local biggest hospital in Taunton, Musgrave Park Hospital. They have a cancer information and support centre. It's based in the Beacon Centre, and that offers information and support to anyone affected by cancer. So you can reach out to them. There's a telephone number that you can ring between the hours of 8 and 5, Monday to Friday. I'm not sure how their service has changed. I did reach out, but I haven't heard back from them yet. I imagine they're still readily available to speak to people on the phone, so hopefully one of my lovely colleagues will pop their telephone number in the comments section for you, so that if you are receiving treatment in our local area and you need to ask any questions, you can give the Beacon Centre a ring. So lots more people joining us now. Thank you all. Good morning. It's lovely to have you here. I have mentioned at the start of the call, but I am covering a very difficult subject today, so if at any point you feel upset or distressed in any way, then please do let us know in the comments section and we can do our best to get an agent to support you. So a little bit about coronavirus and cancer and how the two are kind of affecting each other, really. So I had a little look, did some research. My favourite thing to do, I'm a bit of a research geek like that. So I was looking about how can cancer and treatment weaken the immunity, and then of course it makes you vulnerable to the coronavirus. So we all know the immune system is what protects us, protects our body against illness and infection caused by viruses like the coronavirus and all the other viruses that are out there. So some people who have cancer and are receiving cancer treatment have a weak immune system which reduces their ability to fight these infections. And it's because of some of those treatments, like chemotherapy, it can stop the bone marrow from making enough white blood cells, and white blood cells are part of your immune system. So some types of cancer can also lower your ability to fight infection, and these are usually cancers that affects your immune system, like leukemia or lymphoma. So all sorts of, cancer impacting your vulnerability to coronavirus and vice versa. Really, really tricky time if you are someone who is at any stage in your cancer journey. You are probably concerned about the coronavirus, maybe even more than the general public. So I'm sure, I think we're 10 weeks into lockdown now, but if you are still unsure of the symptoms of coronavirus, I'll just go through them so that you can be aware of what to look out for if you are someone who does have a weakened immune system. So of course we've got the high temperature of above 37.8. Make sure you've got a thermometer at home. I'm sure if you are someone who is receiving treatment you have one, but if you don't and you're finding it difficult to take your temperature without a thermometer, then please do get in touch with one of our agents. We'll see what we can do to try and help if it's something that you need. So one of the other symptoms, of course, is a new continuous cough. So this means coughing a lot more for more than an hour, or 3 or more coughing episodes in 24 hours. And one of the most recent changes to that symptom list is a loss of or change in your normal sense of taste or smell. So if you are someone who is experiencing any of these symptoms and you are receiving cancer treatment, then please do contact your local cancer advice line at whichever hospital you're receiving treatment. Let them know that you're having symptoms, let them know, you know, everything that's happening for you, and fingers crossed they'll get you the treatment or the help that you need. So we have lots of clients who are having treatment for cancer and have been advised to stay at home, have been advised that they're in that vulnerable group because they are at risk of becoming seriously ill if they do develop COVID-19 virus. So if you're one of those people and you've been encouraged to follow particular measures to protect yourself, then it may be that you've been asked to shield. Some of us might have never heard of that term before COVID-19, so as I say, 10 weeks in, you're probably all aware of what shielding is, but just for anybody who isn't aware what shielding is, it means that you stay at home and you avoid face-to-face contact. So for someone who is receiving cancer treatment, they're advised to stay at home. They can continue to have visits from anyone who helps you with essential support, so for example, healthcare staff or carers. And in that instance, if you have got people coming into the home, it's following the guidelines, making sure that they wash their hands with soap and water for at least 20 seconds when they arrive at the home. And of course that means that shielding, potentially not having any time with the family, avoiding gatherings, avoiding being outside, asking for help with your shopping and picking up your prescriptions. We have quite a lot of clients in Sedgemoor who are receiving cancer treatment and are now shielding, and they have a lot of medication to take and they need it picked up quite often. It's not like they can get a month's supply of their medication, so that's something that we have helped with. Our fantastic volunteers have committed to regularly picking up these people's medication and dropping them off at home so that they can continue their oral treatments, whilst they're shielding at home. So that's been really fantastic support for people. Morning everybody. Oh, morning David Melly, it's lovely to have you here. David Melly is one of our regulars on a Thursday morning, one of our professionals that we work alongside very closely at the Talking Cafe, so it's lovely to have you with us. So I remember a couple of weeks back I had a question that somebody asked me, what can I do if my other half or somebody I live with is shielding to help protect them? So I had a little look actually, and there was some advice on the Cancer Research website about how to protect somebody that is shielding that you live with. So it says here, anyone who lives with you who's shielding should be shielding, but you don't have to shield, but you do have to reduce your contact outside the home where possible, so that real kind of quite extreme social distancing. So spending as little time as possible with other people from outside of the home. Obviously we've got the option now to go for a walk or some exercise with one other person. May not be recommended if you are someone that is protecting somebody that's shielded. So some of the information that they give, some of the advice that they give about how you can keep safe at home, so yourself who's protecting and the other who's shielding, they say to keep areas well ventilated. We've probably all got our windows open at the moment because it's hot, but keep that fresh air coming through the house. Try to keep 2 meters away from people that you live with. Try to sleep in a different bed where possible. That is really difficult, isn't it? Really, really hard on people, but ultimately it is for their health and well-being. So really difficult, really feel for you, and if it is something you're finding hard, then please do let us know. Please let us support you with that. The other things they mention is using separate towels, using separate bathrooms if possible, if you're lucky enough to have 2 bathrooms. And of course all the hand hygiene measures, so keeping your hands really clean, avoiding touching your faces, and cleaning those frequently touched surfaces. So depending on your situation, it could be really difficult to stay separate from others at home. So all you can do is your best. Do what you can, support each other through this, and ultimately reach out if it is something that you're really struggling with. So there are some really fantastic links going in the comment section for people to receive support if you need it. So I'm just going to flick through and see who's here. We've got Dale here. Good morning, Dale, and Marilyn as well. It's lovely to have you both with us. So we've got Barbara Ruff here from St Margaret's. I'm going to go on to talk a little bit about St Margaret's because we are really, really, really lucky in Somerset to have such a fantastic hospice available to us. So Barbara is in the comment section giving you some advice, and I'll just talk a little bit about what Barbara has given me a bit of an update on their service. So St Margaret's Hospice, for those who don't know, has been at the heart of Somerset's communities for 40 years, delivering really high quality, compassionate care to patients and their family facing life-limiting illnesses. So it's not always cancer, there are other life-limiting illnesses that they support with. They have a fantastic team who offer medical expertise, nursing skills and specialist support services to patients and their families. So Barbara is the carers coordinator for St Margaret's Hospice. She attends some of our talking cafes and a lot of our events. Pre-COVID, they were running fantastic carers support sessions, workshops. Barbara was visiting carers at home to offer that support, and unfortunately that is now classed as non-essential and isn't happening as it was. But Barbara has told me that she is still offering support over the phone. So if you are a carer of someone who is has a life-limiting illness, then please do reach out to St Margaret's. I'm sure Barbara has put their telephone number in the comment section, but if you want to write it down, it is 01823 333 822. That is the patient and family support advice line, so please do give St Margaret's a ring if you or a loved one need some support with kind of your cancer journey, your life-limiting illness, whatever it might be. Reach out to St Margaret's. And thank you, Barbara, for being here with us. It's really lovely to have partner professionals on board on these talking cafes. So another support line which Christelle might have popped in the comments for us is the Cancer Research UK nurses free phone number. You can ring them 9 to 5 Monday to Friday and ask any questions that you might have. Their telephone number is 0808 800 4040. They're there for anybody, people with cancer and their families who might be especially worried at this time with the virus. So please do reach out to Cancer Research if again it's just another option for you. So much support out there, it's just picking up the phone. I saw in the comments earlier that somebody, probably Christelle, has mentioned a really fantastic support service that's available to us in Somerset called We Hear You. So you'll see them as Y, but they're called We Hear You, and they provide free therapeutic support to children, families and individuals in Bath, North East Somerset and Somerset and Wiltshire who are affected by cancer and other life-threatening conditions. So to find out more about their counselling service, you can contact them on their telephone number, which is 01373 455 255. They have a really fantastic website and they have a really fantastic social media presence, so well worth following We Hear You. I think so many people, it would be hard pushed to find somebody who hasn't been affected by cancer these days, either directly or indirectly. We all know someone who has been affected, and we all need to reach out if it's something that is causing us distress. So We Hear You is a fantastic support service if counselling is something that you think might help you. So another fantastic resource, I'm sure it's been posted again, is Marie Curie. And of course Marie Curie are very widely known, very, very well known of service. They have a really fantastic website actually. They've updated it fantastically with advice that people might need in the coronavirus situation. I have picked out a bit of information that they've updated that I thought might be relevant to a lot of people at the moment. And it is distressing and it's really difficult to think about, but it might be something that you might have to deal with. And that is what happens if you are not able to be with your loved ones when they are at the end stages of their life. That is so difficult, isn't it? I'm sure nobody expected to be in this situation if you were in the middle of or at the end of your cancer journey. This probably isn't how you imagined being in the end stages of your life, or, you know, imagined your loved ones being there. Really, really difficult. You may not be able to visit someone at the end of their life during the coronavirus situation because of restrictions to visitors, your own personal circumstances, or the situation that other family or friends are in. If you aren't able to visit someone in the last weeks or days of life, you're going to have a lot of different feelings. You might find it very upsetting. You might be quite angry and annoyed. It's such a difficult situation to be in. Marie Curie advised to try to remember that it isn't your fault, it's nobody's fault. It's just the best way to reduce the risk of other people getting coronavirus. So difficult. So any feelings that you are feeling, if you're in this situation or you know somebody who is, all those feelings are normal, but they're very difficult to deal with. So it might help to talk to someone about how you're feeling. You can talk to your friends, your families. You can talk to us as agents. You can talk to Christelle as the Macmillan agents. Again, you can ring St Margaret's. But Marie Curie also have a helpline and a really good web chat option as well. So if you think that it would help you to talk about the end stages and how that's going to be for you or your loved one, then please do reach out to Marie Curie. Their telephone number is 0800 090 2309. There is some really lovely ideas on Marie Curie's website about how you can stay connected to your loved ones if you are unable to visit them. So if they are in a hospice or in a hospital at the end stages of their life and you're not able to be with them, it may be possible to phone the person, speak to their care coordinators, find out what's available. They may have a video calling option so that you can still see your loved one. It may be that if you can't visit personally but a relative is, that they could take their mobile phone and they can set up a video call for you so that you can see your loved one. Even if your loved one is at a stage where they're unable to communicate, you know, they may be able to hear you, we don't know, but isn't it worth giving it a go? So you could play some of their favourite music to them over the phone. You could just talk to them, just connect with them on whatever level you can. And of course you can also send letters and cards and whatever it is that makes you kind of feel connected in that moment. But as I say, if that's something that you're struggling with and you would like some support, then please do let somebody know. Fantastic service that's been commissioned in Somerset quite recently is bereavement support during the COVID-19 pandemic. So if you have been bereaved during this period by whatever means, whether that be through a loved one having cancer or a life-limiting illness, then please do reach out to Somerset Bereavement Support. They are here to help if you've been bereaved and need emotional support or someone to talk to during the impact of the current pandemic. So they are available Monday to Saturday, my eyes need to adjust, 9 till 5, and their telephone number is 0800 304 7412. So as I say, bereavement support is out there should you need it. So, 25 minutes talking about cancer. It's heavy, isn't it? It's really hard, but it impacts us all. Like I say, we've all been affected. It's really difficult. The last thing I'm going to say before I perhaps move on to some slightly cheerier subjects is fantastic charity called Copperfield. You may have heard them. They're specifically a breast cancer charity, but they do some really fantastic work, and I've pulled some information off their website that I think is really, really, really important. So a recent poll conducted by Portland showed in the current climate 1 in 10 people would not contact their GP even if they had a lump or a new mole which did not go away after a week. Isn't that really scary? So they stated on that website that many people are concerned about catching coronavirus and giving it to their families, and that's the reason why they're not visiting their GPs. So Copperfield wants to get a really important message out there, just to say how important it is to still contact your GP if you notice any unusual changes to your body, or if you're concerned in any way about any aspect of your health. Your GP is still working, still wants to support you with all of your health issues, not just coronavirus. GP surgeries are still open and they want to hear from you if you have any serious health concerns or symptoms. GPs still want to see people with any worrying changes to, be it their breasts, their genitals, whatever area of the body it is that you are noticing a change. Please do get in contact with your GP and ask for help. If you're worried about visiting the surgery, in most cases initial appointments are done over the phone at the moment, so you might not actually have to visit the GP practice for the reassurance, and if you do need to leave the house for further tests, then they will make sure that everything is done safely. And of course, if it does turn out that this change that you've noticed does turn out to be anything more serious, it's really important that you find out early and get it treated quickly as possible, because it means you'll have the best chance of surviving and going on to live a long and healthy life. Early detection really is the best form of defence, so make sure you are being, careful, watching out for those changes, looking after yourself, and being proactive about all aspects of your health. So I think that's really important, and I would love that if you could spread that message to your friends and families and your loved ones. For those agents that are watching, let's spread it to our clients. Let's make sure that people are being proactive about their health, that they are noticing any changes, and that they are reporting those changes to their GP. So I think that's enough cancer chat for now. It's not a nice subject, but it does impact us all, and I hope that anybody who's watching might be able to take some of that information and pass it on to those who need it. So I've got a few minutes, the sun's shining. Shall we cheer ourselves up a little bit for those 14 people watching? It would be really great if we could perhaps spend just a few minutes talking about what it is that we are grateful for at the moment, what it is that's making us happy. So if you are watching and you could pop in the comments section, let me know what makes you happy at the moment. We talk a lot about what makes us sad and what frustrates us and what's difficult at the moment. What makes you happy? If Marilyn Dodd is still watching, I know that Marilyn, Walking Jack, your dog, makes you happy, and that's really lovely. For me, it's probably sleep. It's probably self-care, so having a bath, or taking a little bit of time to do something for myself. That makes me happy. Could be time with the children, now that we're able to get out and exercise a little bit more. We're able to go a little bit further for walks. It's been really lovely to have some outside time with my children, so that's what's making me really happy at the moment. I am incredibly thankful for conversation. Even in these times when we are isolated, I appreciate every conversation I have, whether it be on the phone or through FaceTime or whatever it means it might be. I am incredibly grateful to still be able to have the opportunity to talk. So Hannah has said that what makes her happy and what she is grateful for is living in the countryside and relative freedom of being able to walk and run in the open quiet. Isn't that so true? I think we are so lucky in Somerset that you don't have to go far to be able to find a wide open space to just get that fresh air in and move your body a little bit. Marilyn has agreed. Jack is her world. Her lovely little dog Jack. She's been able to take him out for short walks across the road. Chrissy has said, having my son here during lockdown makes me laugh so much. Isn't that lovely? I've heard of lots of university students and elder children coming home to live with mum and dad during this time, and how fantastic to have that time as a family again. Probably thought your children had flown the nest and they'd gone, and actually now you've got them back for a little bit of that really, really special time. So Barbara from St Margaret's has said that she is really grateful for my garden and the lovely weather we're having and regular WhatsApp messages with her family. So true. Lots of us appreciating our outdoor spaces and our weather. It's been absolutely beautiful, hasn't it? And for regular conversation with our family and friends. So important, isn't it, to feel connected even when we're apart. Anybody else wants to tell us what they are grateful for? I just hope that it will lift your spirits a little bit before we leave this talking cafe, because we have covered a really difficult subject. and we all have busy days. I have a really busy day today, so I'm going to leave Talking Cafe live event and I am going to dash over to a location where a dairy company are donating a lot of yogurts to us, and what we do is we reach out to community groups as part of the Somerset Food Resilience group, and we offer that yogurt out to anybody that might want to come and pick some up, and then they deliver it out to clients. So I'm darting off there to do the yogurt drop, and then I've got a team meeting with my team at 1 o'clock today, which is always really lovely to catch up and to see people and to again engage in that conversation. Marilyn, she says that she is grateful for her friends right now who are carrying through her sad times. It's so true, isn't it? We are apart, but we are together. We can still feel connected. We can still support each other through this. All of the great things that have come out of this pandemic, such as the times that we stand on the street and we clap, it is making us feel connected, and it is really important that we stick to those things and continue to support each other, because we're certainly not over this pandemic yet, and we still need that support to be ongoing. So Christelle is our wonderful Macmillan agent, and she has said that she appreciates this lovely weather and for sharing the time with her children. It's so true, isn't it? It's so easy to get caught up in what's difficult and how hard it is to have the kids home and still work full time, but actually it's really special as well to have that time with them. Hopefully it's time that we'll never go through again in our lifetimes, and we'll never have a pandemic that causes this kind of a lockdown situation. So as much as possible, I think it's really important to appreciate the time as well as to, work through the struggles of it. So unless anybody else wants to tell me it's something that they're happy about or that they're feeling grateful for, I think I will sign off. But again, really important messages that I have given today, but they can be distressing. So if you are feeling a little bit down in the dumps, or you need some support with something, you're worried about your health, you're worried about how you're going to get to appointments, or whatever it is, please do reach out to us. Send us a message on our Talking Cafe Facebook page. Give us a ring on our 01823 number. Let us know that you need some help. Go onto our website, request an agent callback, and we'll be in touch as soon as possible. And we will do our absolute best to make sure that we get you the support that you need. It's been really lovely to have you all with me today at this Talking Cafe live events. They're going so well. The information is getting out there. We are able to support people that we weren't accessing before. So it's really, really fantastic to have these events available. It's been lovely to spend some time chatting with you this morning. I will probably see you again next Thursday. I'm becoming a bit of a regular. I need to convince my team to have a go. Thanks, Barbara. Thank you so much for joining us. And same, I can't wait until we can catch up properly at a proper in-person Talking Cafe. Thank you so much for watching. Please do reach out if you need some support, and I will see you next Thursday. Take care. Bye-bye.